welcome back to my channel. In this video, I'll be discussing about aggressive periodontitis. Basically, as we know that there are three stages of gingivitis, which is the initial phase, then the early phase, and then the established phase. And then the fourth stage is our advanced stage. So it is in this advanced stage that we see that there is attachment loss and bone loss, which is periodontitis. All right. Now, aggressive periodontitis can be differentiated into generalized and localized on the basis of the percentage of the attachment loss and bone loss. So, if it is more than equal to 30% bone loss plus attachment loss, so it will be generalized, and if it is less than 30% bone loss with attachment loss, so it will be localized. Now, there are certain factors which are called as primary factors and secondary factors. In the primary factors, these primary factors were given by Lang et al. Now, these primary factors are seen to be present in every patient of aggressive periodontitis. Okay, so basically, they are the primary features. So, the primary features are that they can occur in otherwise clinically healthy patient. Second is that there will be rapid attachment loss and bone loss. Third is familial aggregation. Okay. Now, secondary features are that they can be present or they might not be present in all the individuals with the disease. All right. So, first one is that amount of deposit inconsistent with disease severity, increased level of AA comitans, abnormal phagocytic function, hyper responsive macrophages, self arresting disease progression. Okay, now we will move to a very important table that comes for MCQs as well as in theory as well as in Viva questions. So, the difference between localized and generalized aggressive periodontitis. So, first of all, we will differentiate them on the basis of the age of onset. All right. So, age of onset. Localized periodontitis will occur in circumpubertal age, whereas this will most often occur in people who are less than 30 years of age. Okay, now this will be caused mainly, the association will be mainly AA comitans and capnocytophagia, and this will show association with P. gingivalis. All right, here we will see rapid bone loss, here we will see episodic bone loss. Okay, then a very important point is that in this one you will see that there is going to be mirror image pattern, that is bilaterally they are present similar lesions, which is arc shaped bone loss. Here you will see a generalized pattern of bone loss. Okay, very important point to remember here. This will be asked in a lot of vivas. Localized aggressive periodontitis is seen in incisors and first molars. Plus, it will include another teeth other than these, that is more than two teeth. Okay, and this is basically generalized. All right, so this can include. Then we will see, as we know that most of the conditions that are associated with periodontal diseases have a primary cause factor, which is the dental plaque. All right, but in localized periodontitis, localized aggressive periodontitis, you will see that there is the minimal amount of local factor. Okay, and this will be associated with large amounts of local factor. This has a strong familial association, not so strong. Okay, right. So the treatment is basically of aggressive periodontitis is antibiotic therapy. Okay, So suppose if it is a gram-positive organism that is causing, then we will give amoxicillin and clavulanic acid. If it is basically gram-negative, then we will give something like clindamycin. Then if it is something like black pigmented bacteria or spirochetes, so we will give metronidazole. If it is AA comitans, then we will give a combination of metronidazole and amoxicillin. Okay, and if it is P. gingivalis, then we will give azithromycin. Okay, now 2 points that I will tell you that will help you to fetch more marks and have a edge over others. So first is कि the localized aggressive periodontitis, just wait a second. Localized aggressive periodontitis, it is said to have a burnout of disease. Now why this burnout occurs? मतलब कि it arrests spontaneously. Okay, arrest spontaneously. Now reasons. There are basically 4 reasons you must remember. First is कि जो AA comitans है, it produces a leukotoxin, which basically for this leukotoxin, the body, it produces opsonic antibodies, okay, in prepubertal children. But as age increases, immunity also increases. So this has no effect, no more effect. Okay. Then community changes. More with age, more antagonistic bacteria present with increasing age. Okay. Then third point is कि AA comitans loses its leukotoxin. Then fourth is defect in cementum formation. Okay. So now another point that I told you that will help you fetch marks and will actually prove beneficial while you're solving MCQs, especially AIMS questions. So first of all, in genetic basis, usually a question is asked that which is the candidate marker of aggressive periodontitis. So it is basically HLA9 and B15. Then there's one more question कि localized aggressive periodontitis affects which gene and which segment. All right, so it basically affects the Q25 region of chromosome number 1. Okay, then there is one more question that you can do is कि there is a specific gene for IgG2 which causes neutrophil abnormality. Okay, usually the cause is basically decreased chemotactic response to chemotactic agents. Now chemotactic agents like C5A, है ना? Then we have leukotrienes, right? Interleukins and all. So this is it. So these are some of the basic points that you should know about aggressive periodontitis. This is basically for the MCQ purpose. So right. So this is something which will which will form the core of aggressive periodontitis. So there are not much questions asked recently in MCQs because this is a very discarded topic, and moreover in classification also the name is just periodontitis, and aggressive periodontitis is basically discarded. The term is discarded from the classification given in 2017. So yeah. So this is something that will help you to understand the difference. So in case you like the video, do subscribe to my channel. Thanks for watching.